various options that we want to provide for kids here at Kidz Dental Zone. One of the things that we did was I reached out years ago and looked up a medicament called silver diamine fluoride. And what it does is it allows us to apply this medicament to especially to extremely young children, nervous children, adults and children with special needs that have cooperation issues, and allows us to arrest the cavity without the drilling and without the injections and those things. So it's a more gentle approach to an intervention. So people with beginning cavities, it allows us to actually arrest that disease and stop it at that point. And so sometimes if that disease is caught early enough and it's stopped, then there's not enough damage structurally to the teeth, and that can be the end treatment. So simply applying this small drop of clear liquid to the tooth will go in and actually stop the progression of the actual oral disease, because a lot of people don't understand that a cavity is the result of an infection. What you're really treating is an infection which causes the breakdown of the tooth, and the cavity is actually when that tooth collapses. And that's when you see the hole that we all think of in dentistry and around the dentist. I'm going to have this hole in my tooth filled. And that's because the infection's been there long enough to do enough damage to the structure of that tooth. We intervene with this silver fluoride by bonding this on. It's a chemical nature, and the silver kills the bacteria, stops the progression of the disease, and it'll buy you time. So there are children that before, to have restored teeth, would need to go to the operating room, or they may need to take sedative drugs, things that were kind of aggressive interventions, but they were necessary because it's the only way we had to surgically intervene to stop that disease, by placing caps and fillings and physically removing that disease process. With this, we can arrest that process and sometimes get it, if we catch it early enough, allow that child to age and become comfortable with the dentist. And then we can do a lot of those restorations without anesthetic or with minimal anesthetic, or maybe just using laughing gas instead of having to use general anesthetic or sedative medications that they take, and taking that medical risk with them. So it is really more of an approach of medical managing the cavities versus surgically managing the caries. That's what we do. It's simpler, it's gentler, and it's a fantastic option for your children.